Welcome back everyone. Today I'll be sharing my scanning report. Pregnancy basically has in pregnancy you have to do basically 4 scannings. First scanning will be visibility scan where the doctor wants to check your number of fetus and whether the baby has a heartbeat or no. And the second scan will be NT scan where the spinal bone and spinal cord will be checked in NT scan, and third will be anomaly scan, and fourth will be growth scan. So today I'll be sharing my NT scan report to you all. So I was advised to take an NT scan. NT scan basically it is an ultrasound formed during the first trimester of the pregnancy to know the risk of chromosomal conditions in the fetus. It is used mainly to baby's neck and the nasal bone and the blood flow to it. So today in my scanning report, it is a NT scan report. It was my last period date. This is, and this is my LMP. I am 11 weeks 5 days, and according to the ultrasound it is 11 weeks 3 days, and in this it is seen that NT everything is normal. CRL, FHR, cervix, and NT is 1.1 mm, and knuckle bone is present. So all this is there. It was everything was normal, and in this NT scan I came to know that I had a bleeding in the first trimester of my pregnancy, and in this scanning we came to know that it measuring which was a very which was in very large amount. That was its volume was 30 cc in posterior sac of the aspect of the scalp. There were no fibroids found, and I had a single live fetus of 11 days 3 weeks. NT within normal limits, that is knuckle test was done, that was in normal limits. Knuckle bone was visualized and screen positive for pH, then subchorionic hematoma. And with this with NT scan I was asked to do double marker test, which is also important for the NT scan. And with this I had given this is separately done. A scanning will be done and you get this report where the ultrasound will see your knuckle bone, and after the scan you have next is see, these are the reports. This is the baby, and this is the area where the blood is formed, that is subchorionic hematoma. I will explain regarding the subchorionic hematoma in some other video regarding the bleeding. And the double marker test with the NT scan, the report will be something like that. And method, CRL, then scan date, then everything will be present here. And in this the thing is, after once you do the scanning you have to give blood, and there it will be done double marker will be done. You have to give the blood there. After 2 days you will get the report, and in that also it was seen that the calculated risk of trisomy 21 with knuckle transclunacy is below the cutoff, which indicates a low risk. That is, it was low risk, and there is no this is usually done because to see if there are any chromosomal defects, if there are any genetic disorders which are there in this baby also, so that the pregnancy can be terminated as soon as possible. The scan is done. So in this scan you get to know if there are any genetic disorders or any chromosomal defects in the bone. See, the report is normal. The calculated risk for this is it is below 1.1 mm. So this was my NT scan with double marker, and this was my scanning, and this was the report. If you all need any information regarding NT scan, you all can please comment and I'll be ready to answer. This was my NT scan.